Myself, Dr. Rinkal Kataria. I am a gastroenterologist based in Surat, working at the LUMEN Gastro Liver Clinic and Research Center in the Surat only.
So, doctor, question for you is, what exactly is IBS and how would you describe it in simple terms to a non-specialist?
So, IBS is basically a group of symptoms which occurs due to supersensitive intestine. That means the intestine is supersensitive in case of IBS. So it will react to a minor changes like change in the food, change in the sleep or diet pattern, change in the stress level. So this is the IBS. We call it irritable bowel syndrome. Common symptoms which are seen in the IBS are abdominal pain, especially in the lower part of abdomen, and the change in the stool frequency and consistency. Sometimes it can be diarrhea, sometimes it can be constipation, sometimes both on the alternate time.
What are the biggest myths or misconceptions you hear from patients about IBS?
The biggest misconception or myth is patients usually get confused between two similar problems. One is IBS, one is IBD. These two are totally different problems, but patient usually mistaken with IBS and IBD. So IBS is irritable bowel syndrome in which the intestine are otherwise healthy. But IBD is a disease called inflammatory bowel disease where the intestine has a ulcer and the large portion of the intestine has a ulcer. So sometimes patient just remember IBS or IBD, then search on the internet that what this problem is called and they get confused about IBS and IBD. This is the commonest mistake I have seen in my OPD.
Is IBS really a stress disease or is there more to the story?
No, IBS is not just a stress disease. It has multiple factors in it. Stress could be one of those. The most important factor is gut-brain miscommunication. That means our intestine and our brain are constantly chatting with each other, which we call gut-brain axis. Sometimes there is a disturbance in this chat. That's why patient feels the pain, sometimes change in the stool frequency. This is the most important factor. The other factor is usually food sensitivity. Some food which are high in FODMAP, which are some type of carbohydrates which can irritate your gut, which can lead to symptom or worsening of the symptom. They can be trigger also. The other thing is intestinal sensitivity and sometimes the gut bacterial imbalance, like the good bacteria go down, bad bacteria increase. That gut bacterial imbalance could also be the contributory factor and of course the stress.
How does modern lifestyle food habits, stress and sleep contribute to IBS?
So basically lifestyle has a lot to do with IBS. Previously IBS is not this much. Now the IBS is increasing extensively. That could be contributed to a modern lifestyle, especially the food. Right now our food is high in ultra processed food. Ultra processed food are inherently high in the carbohydrate, low in the fat, high in sugar and unhealthy fats. And along with it, it has a commercial ingredient like emulsifier, coloring agent, flavoring agent. They all has an effect on our bacteria. So with ultra processed food, the bad bacteria increases. Second is because of stress, hurried life, anxiety, inadequate sleep or poor sleep quality because excess of mobile use or maybe the bedtime screen and scrolling. So this all has an impact on our gut-brain communication. That's how the modern lifestyle has a huge impact in the IBS. They can trigger the symptom or sometimes they can increase or worsen your symptom.
Are there any warning signs where a physician should immediately refer to a gastroenterologist?
Yes, there are few warning signs which should be looked for before making diagnosis for IBS to any patient. The first is blood in the stool, low hemoglobin, fever. Patient has disturbed sleep due to symptoms like midnight awakening due to pain or diarrhea. The report shows high CRP or high fecal calprotectin, unintentional weight loss. All these are the warning symptoms. If patient has an IBS or maybe diagnosed as a IBS, then symptoms should not be there. If it is there, then patient should be thoroughly investigated to rule out other intestinal major illness.
How often do you see IBS overlapping with anxiety or depression, and how do you address it?
It is quite common because, as we already earlier discussed, it's a disease of a modern lifestyle with some contribution of genetics. So I would say more than 50% of the patient had some component of anxiety and depression. Anxiety is far common than the depression. And to address it, first and most important thing is to counsel, to explain the patient why it is happening.
How important is patient counseling in IBS management? What key messages do you give?
Counseling is, I would say, the fundamental of the treatment. It's a pillar of treatment. In the counseling, we have to explain 4 or 5 things to the patient. First, the number one is the patient needs to be explained that IBS is a long-term disease but manageable thing. Sometimes patient symptoms are not that severe, but they keep on visiting doctor just for the fear of having some major illness related to the digestive system. So we have to counseling them. It does not cause cancer. It is not some kind of infection. It does not cause intestinal damage, but it's a long time. It's a cyclical problem, comes and goes away. That has to be explained. Then we need to explain what it is. As we earlier discussed, it's usually a disturbed gut-brain communication. Then we have to explain that what are these factors like a diet, lifestyle, stress, anxiety, future anxiety or hurried life are contributing to their symptoms. So we need to manage all those things before going on the medicine. So I would say the counseling is the pillar of treatment.
Do probiotics or prebiotics have a role in IBS treatment?
Yes, let's talk first about prebiotic. So prebiotic are basically soluble fiber which we cannot digest, but the gut bacteria in our intestine can digest it, and the good bacteria will thrive on it. Those fiber we called it probiotic. They are usually a natural food or unprocessed food, and the patient who has IBS should have prebiotic which is low in FODMAP. So the prebiotic, which are basically fruits and vegetable, which is a good source of soluble fiber, that should be from low FODMAP category. If I am supposed to give example, the fruit which are good probiotic and less in the FODMAP carbohydrates, so that would be like banana, papaya, grass, cherries. These all fruits are low FODMAP and good probiotic. The vegetables are usually green leafy vegetables like spinach, fenugreeks, and the bell pepper, beans, eggplant, or the gourd family like bottle gourd, ridge gourd. So, this all are the fruits and vegetables which are low in FODMAP and good prebiotic. And the probiotic, which can be natural, which can be commercially available. So, natural probiotic are those which has good bacteria. So this includes curd, buttermilk, cheese, yogurt, kimchi, or fermented vegetables. They are good source of good bacteria. They are the live bacteria, so we called it as a probiotic. And the third is commercially available probiotic. So commercially available probiotic should not be the random or over-the-counter probiotics. Because the type of bacteria in probiotic matters, the number of bacteria, the doses of bacteria also matters. So it should be tested in the well-designed study, and the beneficial effect should be proven. Then we will recommend the probiotic which are commercially available for the IBS patients, especially when the diet counseling not working and we cannot manage the symptom alone based on the diet and counseling.
What advice do you give to patients for long-term gut health and relapse prevention?
So I will give 4 long-term advice. One is good diet habit. That means the regular meal, unhurried meal time, portion control in the meal, as well as having varieties of low FODMAP category, fruits and vegetable and nuts in their diet. Second one is good sleep and quality sleep, adequate at least 6 to 7 hours of sleep and the regular sleep-wake cycle. The third, I would say, stress management like meditation, yoga. So managing the stress can help in reducing your symptoms, sometimes may prevents the trigger for the symptom. And the fourth one I would suggest is exercise. So these are the common routine lifestyle changes which can help patient in managing their symptom. Sometimes we can manage patient without medicine based on the lifestyle changes and can prevent relapse of the symptom, or sometimes symptom we can bring it to bare minimum.
What's your gut-friendly morning habit?
So, if I need to describe in one or two words, I would suggest unhurried morning routine. That means in the morning, once we wake up, it should be calm and relaxed. Have a 1 or 2 glass of warm water, then walk around for 5 to 10 minutes, then squat for 2 minutes in the toilet to have a clear and complete bowel movement. So, unhurried morning routine with a complete and clear bowel movement would be my most suggested gut-friendly morning habit. In the end, I would say the thank you for this wonderful opportunity to sharing the knowledge about the common problem like IBS to the patient and other people. Thank you for this wonderful opportunity and giving time for this. Thank you.